On June 18th, children 5 years old and younger became eligible to get the COVID-19 vaccine. And the Centers for Disease Control and Prevention wasted no time pushing parents to get their kids vaccinated. But a closer look at CDC data shows that as of July 20th, less than 3% of kids 5 years or younger have gotten at least one dose. KFF published that analysis, and it shows just 2 weeks after the Food and Drug Administration cleared this age group for vaccinations, their vaccination rate peaked.
Meanwhile, media headlines like "Parents anxious to vaccinate children," "The agony of parents with children under age" dominate the narrative on this issue. Here to discuss is writer David Zweig and author of the nonfiction book Invisibles. Welcome, David.
Hi, thanks for having me.
So this is interesting. I saw you point out on social media that, for all the expectations that health officials had that there would be, massive interest in getting young children vaccinated, it doesn't look like it's happening.
Yeah, it definitely appears that there is a wide chasm between what the CDC and other health officials had predicted and had wanted to happen and from what has actually happened. The last I checked, I think it was around a week ago from the AAP, I think it was something like 4.7% of children under the age of 5 were vaccinated. I mean, it's a pretty extraordinary figure.
Yeah, do you think this was a failing on sort of public health officials or people recommending strategies to not anticipate that the demand wouldn't be what they thought it would be?
I wouldn't describe it as a failing in that sense. I think what this shows is that there's a pretty significant disconnect between what the majority of the public or parents believe about the necessity of the COVID vaccine for their children. Even the next age bracket up, the 5 to 11-year-olds, that's been approved for I don't know how many months at this point, and I think that's only at something like 37%. So I mean that is really, really low. Even that, it's not as low as the 4.7% for the youngest kids. But there's a real disconnect here, and I think people in public health probably need to ask themselves what has gone wrong. And one thing that I'm quite certain is not part of it or it's certainly not the driver of it, is the notion that it's just the bad people, the crazy anti-vax conspiracists, because those people aren't persuading, 95% of the public.
So you tweet a study in media framing, and then you tweet out these screenshots that I referred to. In the intro, parents anxious to vaccinate young children describe an agonizing wait. My kids can't get vaccinated yet, and I'm barely keeping it together. The agony of parents with kids under 5. So you're suggesting there's a media framing on this. What do you think is motivating this framing, and how would you describe what this framing is?
Well, I mean, from the headlines that I had tweeted out, they're clearly, just as there is a disconnect from the public health authorities from what the majority of the public and majority of parents are thinking, and again, we're talking about 95%. So majority is, a pretty significant understatement. There's also a disconnect between the media and a large percentage of the public as well. And it's not, I can't speak to motive. I don't know what's going through the minds of the reporters and editors who are writing these articles and these headlines, but they clearly had a particular story they wanted to tell. We certainly know that writing a story where you're talking about the agony of waiting was highly anecdotal. Now, that doesn't mean it's not newsworthy, but when you are doing reporting on an anecdote, it's really important to place that anecdote in context. And as you can see from the headlines, they don't do that. They are designed to give the impression of a larger type of atmosphere. And the impression that they gave was wildly, wildly inaccurate.
And it has to do with, the fact that I would gather that a lot of parents, upwards more than 90% of them, understand and internalize the true scientific fact that there is extreme age discrimination with COVID, that very young kids have not had, barring exceptional circumstances, immunocompromised conditions, maybe morbid obesity. Some kids certainly can be at risk of COVID if they have other health issues going on, but if you look at the statistics, by and large, this is not. It's hard to find. In fact, it's hard to find significantly better outcomes in terms of health for kids who get vaccinated. Which is not that the vaccine is doing anything wrong. It's just they would have, in overwhelming number of cases, they would have been fine without it too, just because it doesn't impact this category very, very badly. And that's something I think that clearly most parents understand that maybe the media has missed or doesn't want to talk about for some reason.
Yeah, it is a fascinating sort of case study, if someone wants to write a dissertation on this, and to view the media coverage leading up to the different pediatric vaccine approvals, and then look at the actual pediatric uptake of the vaccines themselves, and to see that disconnect. And I think that most parents have intuit that when they see their children have already had COVID, they're aware of the data, at least, in abstract. Obviously, everyone's not following this stuff super closely and reading, the trials from the different vaccines and looking at the latest studies, but they have an intuitive sense. There is, this is about empiricism. It's about empirical reality. And when you've seen everyone already have COVID, you've seen every single child who already had it and it was mild, they intuit. There is, I think, the sense that most people have in their mind, which is first, do no harm. This doesn't mean getting vaccinated is a bad idea for children, and I'm not suggesting that. But what I am suggesting is that clearly the evidence shows that most parents are saying, look, I understand there is an extraordinary age stratification, regarding risk. And that was even before getting COVID. Now my child has already had COVID, and we know way upwards of 75% of kids have already been infected. And being infected before is going to reduce the likelihood of infection again, or the likelihood of severe disease. So you took something that was already, thankfully, incredibly low, and then you made it even lower by already being infected before. And the average parent clearly views this as just something that's not urgent for their children at this time.
And the idea that some school districts, for instance, were going to require some level of vaccination at a certain age group. I don't know exactly. There might be somewhere in the country. I don't know that it's the case that anyone is requiring for this age group. But I know in DC schools they are requiring in the 12 and older category to be vaccinated to come to school in the fall. And something like 40% of African American children in that age group in the district are not vaccinated and are thus at risk of not being able to return to school. And it's like, not having the social stability of going to school is by far, it's not even close, worse for their achievement in math and reading, their social skills, their likelihood to not fall into crime. It's unbelievably bad for them to keep them out of school compared to the threat of the disease if they're not vaccinated.
It's really a remarkable occurrence, any discussion whatsoever about mandating the vaccine for children. There really is no, epidemiological basis behind a mandate. We know that the vaccines, for a very transient period of time, will reduce the likelihood of infection. But that protection against infection wanes, and quite dramatically so. And we all, again, I'm talking about empiricism. We can see this ourselves. We all know people who are vaccinated or boosted or double boosted, and they still got infected. That doesn't mean the vaccine isn't helping to protect against severe disease. Right. But when we are talking about a social benefit, which typically is the underlying reason behind a mandate, we don't always or often mandate a medical product solely because of the purported benefit to the individual. The underlying reason why a school district would do it is to say, hey, we need you to have this thing done because you have an obligation to the community. But the vaccine isn't doing that to any degree on a large scale that would make sense, particularly so for children who've already been infected. I have not seen any data to show what the actual reduction is in severe disease or illness from a child being vaccinated versus a child who's healthy, who's already had COVID. We haven't seen any of that real world data yet.
And what are the rates of children who have already had COVID?
I mean, this is quite a while ago. It was north of 75%. So it's certainly above that now. And this is, one of the other things that I tweeted about the other day. This dovetails with the concept that there was a large piece in the New York Times the other day where the author, and the Times piece is not alone in doing this, where they referred to anybody who has any questions whatsoever about a vaccine as an anti-vaxxer. The article referred to, there was a guy, Rob Astorino, who was running for governor of New York. He said, I am vaccinated. I encourage you to get vaccinated. He wants people to be vaccinated, but he said, I'm not against mandating it for kids. It shouldn't be required. He was listed as an anti-vaxxer. How can you call someone, by the way, the people on the FDA and CDC advisory committees, they ask questions like this. I asked, people, what is the evidence I'd like to see on what is the protection, what is the absolute risk reduction of severe disease for a child who's healthy, who's already had COVID, if they already get vaccinated? What is the risk reduction in an absolute sense with those numbers? And some doctor on Twitter went ballistic and called me an anti-vaxxer. I was like,
unbelievable.
Those are the questions that professionals are asking and should be asked. This notion of using language to call everybody an anti-vaxxer because they want to ask a question or they're against mandating it for a child is designed to shut down debate.
Yeah,
it is designed to make people afraid to say something because you're branding them something that has a strong negative connotation to it. And it's inaccurate. It is an imprecise and inaccurate language.
Unbelievable. Well, David, thank you so much for joining us. It's always a pleasure.
Thanks for having me again.
Next up, Senator Rand Paul will join us. Stick around for that.